I've always wanted to be a doctor since I was a small child, and wasn't quite sure what till I got closer.
Initially, I knew I wanted to be a surgeon, I swear, as early as third grade.
My dad was a general and thoracic surgeon, and I started operating with him when I was 12 years old. And I always thought I was going to be a cardiothoracic surgeon. And when I was in medical school, my sister actually had an operation, and she went from the most quiet introvert to the most outgoing extrovert.
My early fascinations with medicine were to become a family doctor, and then I was exposed to surgery, where I saw the ability to be a family doctor and a technician, working with your hands, designing things, recreating things, rebuilding things, and that fascination led me to plastic surgery.
I always thought I wanted to be a heart surgeon, and I realized that early on in medical school that was really not what suited my personality. And I found a lecture in plastic surgery, and the diversity in plastic surgery, there's no bounds in terms of age or gender of patients and body locations, and that was the most interesting career path for me.
When I went to med school, I thought I was going to be a surgeon of some type. I wasn't sure what type. My anatomy professor was Robert Chase, and he is a plastic surgeon and a hand surgeon as well, and he showed videos during lunch that were optional of what he used to do when he was in active practice. He had retired and become a professor of anatomy at Stanford.
So I said to my dad, what happened? And he said she had a breast augmentation. And it was amazing to me that I realized that an operation can totally change the way a person perceives himself.
And I thought it was amazing. I mean, the things, he could make breasts out of parts of people's backs and stomachs. He went to leper colonies in India and restored movement to paralyzed limbs. I mean, just outrageous things, making noses, making ears, you name it. And I said, this is for me.
And so I thought, well, I'm going to look into this. So when I was in medical school, I did a 1-month rotation at Stanford University out in California in plastic surgery, and I did a 1-month rotation with one of the best heart surgeons in the world at Jefferson in Philadelphia. And at the end of it, I realized that plastic surgery allows me to look at each problem and create a new solution. You have to use artistry, you have to use your knowledge and your skills to get the result you want. And so every day is a new exciting day, and that's why I became a plastic surgeon.
It's a happy specialty. Patients, love what you do, and you can really change people's lives.